Every woman's body is unique, but when it comes to your menstrual cycle, there are some clear signs that should never be ignored. Your period is not just a monthly inconvenience, it's a vital sign of your health. In fact, doctors often refer to the menstrual cycle as the fifth vital sign, right alongside body temperature, heart rate, breathing rate, and blood pressure. But how do you know what's normal and what's not? Let's be honest, many women silently endure symptoms every month that disrupt their lives, drain their energy, and sometimes leave them anxious, confused, or even afraid. And sadly, so many of these symptoms are brushed off as just part of being a woman. But here's the truth. You should never feel ashamed or helpless about your menstrual health. If something feels wrong, your body is speaking and it's time to listen. In this video, we're breaking down the 5 most important signs that your period is not normal, and more importantly, what you can do about it. This isn't just about information, it's about empowering you to take control of your health, understand your body, and protect your future. Let's dive into it. SIGN number 1. Extremely heavy bleeding menorrhagia. Let's start with one of the most common but often misunderstood menstrual issues, heavy bleeding. If you're soaking through pads or tampons every hour for several hours in a row, or if your period lasts longer than 7 days, you may be experiencing menorrhagia, a medical term for abnormally heavy or prolonged menstrual bleeding. Symptoms to watch: needing to change protection every hour, passing large blood clots larger than a quarter, feeling fatigued, dizzy, or breathless during your period, periods lasting more than 7 to 8 days. What causes it? Hormonal imbalance, especially estrogen and progesterone, uterine fibroids or polyps, endometriosis, these issues, blood clotting disorders. Risks of ignoring it: iron deficiency, anemia, chronic fatigue, quality of life, long-term. Reproductive health problems. What to do: track your bleeding with a period app, take note of clot size and frequency, get your hemoglobin levels, check it, see a gynecologist for ultrasound or hormone testing. Consider treatment options: iron supplements, hormonal therapy, or minor surgical interventions. Pro tip: if you feel like your period is interfering with your ability to work, sleep, or live your life, that's not normal. Don't minimize your symptoms. Seek help. SIGN number 2. Irregular period. Some women have their periods like clockwork. Others never know when their period will strike. While occasional irregularity can be normal, especially in teens or approaching menopause, frequent irregular cycles can signal deeper problems. What's considered irregular? Cycles shorter than 21 days or longer than 35 days, missed periods for more than 3 months without pregnancy, bleeding more than once in a month, unpredictable flow or timing. Common causes: polycystic ovary syndrome, PCOS, thyroid dysfunction, extreme stress or anxiety, weight gain or loss, eating disorders, or poor nutrition. Risks of ignoring it: fertility problems, hormonal imbalances, worsening metabolic issues, especially with PCOS, delayed diagnosis of serious conditions. What to do: track your cycles religiously, watch for related symptoms: acne, hair loss, weight gain, mood swings, eat a balanced diet, and maintain a healthy weight. Consult your doctor for hormone tests: FSH, LH, estrogen, testosterone. PCOS often needs lifestyle management plus medication. Remember, irregular periods are often the body's cry for help. Don't wait for it to get worse, act early. SIGN number 3. Severe pain, dysmenorrhea. Yes, cramps are common, but pain that knocks you down, keeps you from functioning, or brings tears to your eyes, that's not normal. Painful periods are called dysmenorrhea, and there are 2 kinds: primary dysmenorrhea, common cramps without underlying disease; secondary dysmenorrhea, pain due to conditions like endometriosis or fibroids. Red flag symptoms: pain starts days before bleeding and continues throughout. Pain spreads to lower back or legs. Over-the-counter meds don't help you miss school, work, or social life due to pain. What could be causing it? Endometriosis: tissue-like uterine lining grows outside the uterus. Fibroids: non-cancerous growths in the uterus. Pelvic inflammatory disease. Pit. Adenomyosis risks: pain affecting mental health and productivity. Fertility challenges: chronic pelvic inflammation. What to do? Use a pain tracker to measure pain intensity. Use a heating pad, magnesium, or gentle exercise for relief. Get a pelvic ultrasound. Ask about hormonal treatments or minimally invasive surgery if needed, and let anyone tell you it's just part of being a woman. You deserve a pain-free life. Period. SIGN number 4. Spotting between periods. Spotting or light bleeding outside of your normal cycle can sometimes be harmless, but frequent, unexplained spotting can also be your body waving a red flag. When spotting is not normal, happens frequently between cycles, occurs after sex, associated with pelvic pain, or odor, occurs during menopause. Possible causes: hormonal birth control adjustment, cervical or uterine polyps, infections, cysts, endometrial hyperplasia, signs of miscarriage or ectopic pregnancy. Why it matters. Spotting may mask more serious reproductive issues. Delays in diagnosis can worsen fertility problems. It may point to cervical or uterine abnormalities. What to do? Don't ignore recurring spotting. Get a pap smear or pelvic exam. Check for hormonal or infectious cause. Track spotting patterns in your period. Discuss non-hormonal and hormonal treatments with your doctor. Your body is never random. Everything is a message. Spotting is one you should always investigate. SIGN number 5. Missed periods. Amenorrhea. Missed periods are often thought of as a sign of pregnancy, but what if you're not pregnant? That's called amenorrhea, and it's a clear sign your reproductive system may not be functioning properly. Types: primary. Periods never started by age 16. Secondary. Periods stop for 3+ months after being regular. Causes: stress and burnout, overexercising, sudden weight loss, or eating disorders. PCOS or thyroid dysfunction. Premature menopause. Hidden risks: bone density loss, osteoporosis, infertility, terminal collapse. Mental health struggles. Solutions: reevaluate lifestyle, nutrition, sleep, stress. Consider CBT therapy for eating disorders or stress management. Get thyroid, prolactin, and estrogen levels tested. Rebalance naturally. Whole foods, healthy fats, strength training. Seek medical help if period hasn't come back in 3 months. Missing your period is not freedom, it's your body asking for rescue. Conclusion: honor your cycle, honor yourself. Your menstrual cycle is not a curse. It's a vital part of your overall health, physically, emotionally, and hormonally. It tells you when things are balanced, and it tells you when things are not. If you're experiencing any of the 5 signs we covered today, heavy bleeding, irregular cycle, severe pain, unusual spotting, missed periods, then don't delay. Don't wait. Don't normalize the abnormal. Talk to your doctor. Track your symptoms. Fuel your body. Balance your hormones. And most of all, listen to what your body is telling you. Your body is not your enemy. It's your most loyal messenger. So trust it. Take care of it. And treat it with the love and respect it deserves. Because a healthy cycle means a healthy life.